I'm Rebecca Gordon.
I'm Sylvia Gordon.
And on this episode, which is going to be long, you're going to want to have paper and pencil. We're going to talk about health savings accounts and how HSAs, you don't know the rules, can really trip you up with Medicare. So get paper, get pen, get ready to take some notes.
So a health savings account is the most tax efficient, I'd say the most that you can have, because it goes in tax-free, it grows tax-free, you can take it out if you use it for qualified medical expenses without paying taxes on it. It's a triple win. There's no other triple wins.
Home runs.
If you have a 401k, you can put it in tax-free, you can grow tax-free, but when you take it out, you have to pay taxes on it. And that's how most things are. The government eventually wants their piece, not on an HSA. An HSA is awesome, but if you want to work past 65,
It becomes cloudy when you get older. When you're younger, HSAs are easy to understand. When you get older, now we have to worry about the Medicare rules.
right. So if you want to work past 65, and more people do, and they want to contribute to their HSA because their employer is also contributing, right? First of all, the first hurdle is your employer group plan must have 20 or more employees. Okay, that's so you don't have the penalty for Medicare.
Okay.
Right? So you can continue to work and defer Medicare without the late penalty. So now, we already said what an HSA is. HSA, you can take the money out and use it for qualified medical expenses.
You can go to the IRS website and it gives you a huge list of everything you can use it for.
And it's like 250 things.
It's really awesome. It's a lot of wigs if you need it, from
Right.
chemo, or
Can't you buy a boat?
you could buy a boat.
So we always say you can use it for qualified medical expenses. But after 65, you can use it for non-qualified medical expenses, like anything, like a boat, like a facelift, like new shoes. But you'll pay federal and state taxes when you take the money out. Just like you would take money out of your 401k, you pay whatever tax bracket you're at. So yeah, you can buy a boat.
It's not a bad trade-off.
Okay, so remember, those taxes are going to hit you. You're not going to avoid it unless it's a tax qualified expense. And we have a white paper on our website, gordonmarketing.com, that will go into all that and list the 250 qualified medical expenses. So if you contribute to your HSA,
How long can you contribute?
so you can contribute from 65 until your full retirement age. So when were you born?
71.
So anybody born in 1960 or thereafter, your full retirement age will be 67. If you're born prior to that, it's based on the year you were born. So for us, our full retirement age will be 67. So from 65 to 67, we can contribute. Our employer can contribute. We have that tax.
Is that to my birthday when I turn 67?
Yes, because our full retirement age is a flat 67. Okay. So other people's, it's like 66 and 9 months and a little bit more confusing. Okay. So we can contribute for those 2 years. Our employer can contribute for those 2 years. We can reap those benefits, but we can't go past our full retirement age because Social Security will automatically start. So to contribute to an HSA, you can't have any other health insurance.
But what if I want to keep working? I
You
want to
can
work past 67,
You can work.
but I can't contribute anymore.
Nope. Neither can your employer.
Hmm.
Okay, so you got that window. Now, the reason you can't have Social Security, because if you sign up for Social Security, you automatically have to have Medicare Part A. You can't have Social Security and not have Part A. Don't ask me why. It's just how they wrote it. So if I want to continue to work past 65 and keep my high deductible health plan, and I'm taking early Social Security, no. One or the other.
Okay, so you cannot continue to contribute to your HSA with any other health insurance.
Right. And the thing is, people don't think Medicare Part A is other health insurance.
Right.
Because they didn't
I
pay
wouldn't.
for it. It's premium free.
Right.
So
Yeah,
They don't
I
think
wouldn't
about it.
consider that.
but having Medicare Part A is the juggernaut that throws everything
So
off
that'll
here.
throw you out. That's
So,
when you're done.
and if you have Social Security, you have to have A. You can't have Social Security without A. So some people will turn 65 and sign up for Social Security, and they're working only part-time, but they're getting their Social Security without a reduction. They want to continue to get their HSA at work. You can't.
You can't. Right.
So if you already did it and you're like, you can resend your Social Security. I call that unretiring. You can pay it all back. If you've only been on it a year or less, you can pay it back. Get off Social Security, get off A, continue to work, continue to make contributions to your HSA, and your employer can continue to make. Now, TRICARE is also considered any other insurance. You can't be on TRICARE.
Well, that makes sense. I think of TRICARE.
Right, TRICARE, I think of it as insurance as well. Okay, can your employer continue to contribute to your HSA even though you can't? No, I think that one actually makes sense. So what happens if people that screw this up and they contribute anyway? That's what most people do. They just screw this up.
They just won't get the tax benefit.
They won't get the tax benefit. For excess contributions, their accountant will have to sort it out.
Not a big deal.
So some of the things that you can spend your money on, your HSA money.
So you can spend it on, like, you have long-term care costs listed, deductibles, co-pays.
Right. So
There's a lot of
the
things
thing
you can spend it on.
the thing everybody asks is, can you spend it on a Medicare supplement premium?
No.
And
Never
they're
have.
like, well, then why not?
We didn't write the rule.
They wrote it that way.
Trust me, if we wrote the rules, it'd be a little different.
It'd be a little bit better.
A little easier to
The whole thing is, the reason this is so screwed up is because we didn't have HSAs until 2003. We've had Medicare and Social Security for 57 years and 81 years. So we already have this big thing built up, and then they threw a HSA in there, and they're like,
There's another blanket.
Yes. So the main thing to remember is, with HSA money, you cannot pay for your Medicare supplement, but you can
do long-term care.
You could just write yourself a check.
Yeah.
So just write yourself a check every month to reimburse yourself for Medicare Part B.
And that's not actually, can you raise that? Because that's not on our screen.
That's right down here, but
okay,
we'll just go.
Because that's cool.
Yeah. Because a lot of people are like, I'm healthy.
That's very
What
cool.
am I spending my money on?
To do that.
What am I doing with it? Okay. If you sign up for Social Security before 65, you're automatically on Part A.
You're out.
You're out. So that's where you got to remember it. Okay, but there's even more to this fun rule.
As there should be.
As if that wasn't enough to digest. When you finally do decide to retire, so let's say I'm 66, and I was like, okay, I got an extra year out of the contributions. That was nice. But now I'm out. I want to retire. You have to have stopped your contributions and your employer's contributions 6 months before you apply. A lot of stress on the word apply for Medicare Part B. Not 6 months before you get Part B. 6 months before you apply for Part B.
I don't.
The reason I looked into it, and the reason is that he said they made Part A retroactive because a lot of people were retiring and didn't know what to do, and they weren't doing anything. And since Part B was already paid for, Part A was already paid for, that they were going to make it 6 months retroactive in case they had medical expenses because they didn't know what was going on because everybody's so lost in the system. So the government was trying to do something nice. But by doing that something nice, making it retroactive, it totally screws up people.
So what if somebody does put it in?
Then you lose the tax advantage.
They don't know. Who the heck is going to know that? Well, hopefully you're going to tell your client, which is why you're watching this.
Right. So you are the solution to
You're
the
the
problem.
expert.
You are the solution to warn your clients that want to continue to work past 65. Because no possible way would they even think that there would be a problem.
No possible
right?
way.
So the 6 month look back. Okay. 6 month look back.
It's based on the application date.
So if I want to retire at the end of the year, December, and I want to sign up for Medicare Part B to start January 1st, I have to have stopped my contributions and my employer's contributions back in June.
6 months before December.
Right. So if I apply for Part B for January 1st, December, then they're going to go from that. But what if I applied? You can apply a couple months early, right? What if I applied 3 months early for my Medicare Part B to start January 1st? Because I'm one of those do it early ladies. It's going to trip you.
This is very true.
It's going to trip you up because it goes from the day I applied
But
for
it's
Part
the
B,
date of the application.
which could be October 1st. And I stopped my contributions 6 months before I started Part B, which would be June. Are you following me? Yeah. Rewatch this video a couple times. That will make more sense maybe the third time you heard it. The 6 month look back is not going to hit you in the month you turn 65. So thank God something made sense there. Okay, so let's talk about the Medicare penalty. So I'm going to quit work. My agent explained to me I had to stop my contribution 6 months in advance. How long do I have to wait before I have to sign up for Medicare Part B?
8 months.
And I was like, I had this poor lady on the phone.
Who's going to know that?
And she was like, well, I was told that I have 8 months. And I said, well, you kind of do. You only have 3 months to get Part D. So you're not going to get your Part D you can't have it without A or B. So basically it's 3 months. They're like, well, they said it was 8 months. Well, technically it's 8 months.
Good Lord.
But really, I tell everybody 3 months.
Oh my.
Because if you want Medicare Advantage, right? And if they do screw this up, then they get a lifetime penalty.
Yeah, that's beautiful.
So how about your people that are eligible for Medicare, but they're like, I'm just going to stay in Obamacare? We get those people. They're like, I'm happy with it. I'm just going to stay there. I have an HSA.
Stay. But you're not on an eligible plan for your contributions.
And Marketplace is not going to be credible coverage to prevent a late Part B penalty. So basically, if you're eligible for Medicare, go to Medicare. If you want to keep your HSA, it better be a group HSA.
So that's the big picture. If you want to continue to contribute, you got to be on a group HSA with 20 people or more, correct? And and if you take A or anything, that's going to stop you. So you have to.
Any other health insurance.
You have to make sure you're not taking anything until you're ready, till you make that choice.
And it will not be later than your full retirement age because Social Security is automatically going to put you on A at your full retirement age. Regardless of what you want, it's automatic. That's a sleeper. I gotcha.
Mm-hmm. Okay, so let's look at an example real fast. Let's say we have a client, a lady who is applying during the month of September in order to retire and begin benefits October 1. So her application is September 1.
So her Medicare Part B and A will start
October
1. So it means
September.
When
1st.
did she have to stop contributing to her HSA?
6 months before September.
So not 6 months before October, which would make sense.
Application
God knows
date.
We don't want any of this to be easy.
Application date.
From the date she applied. And she could have applied even sooner, right? But she applied from the date she applied. We go back 6 months. That's March. If she had no contribution and her employer had no contribution, since then, she reaps the tax benefits for those last contributions for the last year of working. Ba-bum-bum. Woo!
Remember, contribution limits for HSA change annually. They typically go up every year with the cost of living adjustment.
So, if you want more information about HSAs and Medicare and Social Security, we have a white paper on our website. Go check it out at gordmarketing.com.
Good selling, folks. See you soon.